Hello friends, welcome back to the channel. Welcome back to UK Dreamers. Today I've got a very special friend of mine, Dr. Benjamin Arnold, who is a ST5 in emergency medicine training. And today we would be talking about less than full-time training. What is less than full-time? How do you apply? What are the benefits? What are the drawbacks? And the words of wisdom from Ben himself. So welcome, Ben. Welcome back. Welcome to the channel. Thank you so much for your valuable time, Ben.
Not a problem, my man.
All right, Ben. So how is a life in being a less than full-time doctor?
It's fantastic. Wouldn't ever go back.
Okay, wouldn't ever go back. That's pretty, that's pretty encouraging for people who don't even know what this concept is. So for guys like us who come from a different country into a different medical system, we rarely know what are the various, pathways we can go through. And apparently, I think less than full time, if you're a family man, if you've got other commitments, I think it's a great option for. Could you tell us a little more about what is less than full time?
So essentially you choose a percentage of full-time work that you want to work. So I chose to go to 60%. And that means that essentially I do 60% of the hours that a full-time trainee would do. Obviously, it means that we're adding time onto my training so that I've done the same hours as everybody else. But it just means within a week, I will only work, say, 24 hours instead of 40 hours.
Okay, that sounds quite promising. So, for instance, if the ED training per se is for 6 years, what are we expecting if we go to like around 60-70% in the training?
It all depends on at what point you choose to go to less than full-time training. If you do it from the very beginning, it means that you're going to be working the best part of 10 years as a trainee. For myself, I joined less than full-time training halfway through my ST4 year. I need to do some quick maths in my head. It essentially is adding about 2 years onto my training from what I would have done before.
Okay. So what made you go, what made you think and opt for a less than full-time training, basically?
So back in 2019, I was going through a bit of a rough period in my life. And things were exacerbated by the fact that I was working 45-hour weeks as an emergency medicine registrar, and I was absolutely exhausted. I was finding that at the weekends, all that I would be spending my time doing is recovering from the week that I've just worked. And my wife and I were expecting a child. I just decided that's not how I want to be, that I don't want to be tired on all of my days off, and I want to enjoy family time. So I just decided, do you know what? Let's go less than full time. Let's just commit to it. Let's go all in and go to 60% training and see how it goes. And I haven't ever looked back, I don't think.
That's great to hear. So how different is it, like before you had opted for less than full time? You said like you're struggling and everything. What sort of struggle are we talking here, Ben? Like is it the physical exhaustion that we're talking about, or like how is it different? Like I'm still in the lower grades, junior grade, but yes, I can feel the exhaustion, definitely. So how difficult, what's the main thing that you think made you go into this, apart than the family stuff and everything?
I could cope with the physical exhaustion. It was the mental exhaustion that I was really struggling with. I was experiencing burnout, compassion fatigue. I was getting into arguments with people unnecessarily at work, and just not emotionally reacting to stresses the same that I normally would do. And we talk about a stress bucket, and we talk about starting work with your bucket not being full, so that you've got a bit of space to accommodate any additional stresses. And I was finding that I was going into work every morning with a full bucket, and it didn't take a lot to tip me over. And I just needed, I tried different techniques, like trying to slow down the pace that I was working at work. And I struggled to do that because I like to put 110% into my work when I'm there and give the best care possible to my patients. And I couldn't turn that volume down. So I decided that the only way to get over that was to do less shifts at work.
I'm already feeling tempted, Ben, I'm telling you. All right. Okay. So if one decides to opt for this flexible working hours or the less than full-time training, how do they approach? Whom do they approach? Like,
So you should have a less than full-time lead for your deanery. In the West Midlands, it's Helen Goodyear. So you could always contact them to just ask their advice more than anything. Particularly within the West Midlands, on their website, there are the forms that you need to fill out and submit to your deanery just to request it. We're lucky within emergency medicine that you don't actually need an excuse to go less than full-time. You don't need to say, oh, I've got family carers needs. That was the reason that I gave for going for less than full-time, but actually you don't need a reason at all. You can just choose to do it. Okay. You submit the paperwork. I think you need to give about 6 weeks notice so that your rota coordinator can sort everything out from once the paperwork's been approved. I set a 6-month deadline for mine. So I said from February 2020 that I was going to go less than full time. And that was sort of my target goal.
Great. So it's not that complicated as like people would expect it to be, basically.
No, I found it quite an easy process, to be fair.
Okay, great to hear that. So how does it impact us financially? So because if you're working less, I think we would be taking home less money.
Yeah, so it doesn't necessarily equate to exactly 60% of the pay. It's done on a basis of, so you take your base rate will be 60% of a full-time base rate, but then your extra hours, your anti-sociable hours, your night shift payments, your weekend payments are all done on the basis of exactly how many you're doing. So I'm still working full-time weekends, so I still get that full payment for the weekends. It works out roughly 60% for me, or if you became 80%, it would work out roughly 80%. And to put that into monetary terms, I think at the moment, a full-time hire registrar would be on about 65, 67,000. I think mine's about 45,000 at the moment per year. Okay. It works out about 2,500 a month after tax and pensions and whatnot.
Yeah. Okay, so yeah, that's a basic difference. I would say take home is quite different, but yes, the amount of work that you're doing, the amount of things that you're doing is also less. I've also heard, Ben, that people who want to do some out of training commitments can also opt in for a less than full time. Is it true? Like someone wants a year off to go explore something out of UK basically.
So I think if you wanted to take a complete year out of training, the option would be to take a out of program experience, or an UP, people call it. And I think for that process, you need to take about 6 months notice and just submit, again, more paperwork to your deanery. But I've done that in the past and it wasn't too hard. And as long as you can demonstrate what you're going to be doing for that year, I think they're pretty open to people going away and getting different experiences, because we don't all want to be generic consultants in the future.
Yeah, true, absolutely true. So Ben, what are the main attractive advantages you would say of going less than full time?
So I've got a bit more flexibility as to what shifts I'm working, because I've got days off during the week. At the moment I've got it fixed that Mondays and Tuesdays are my less than full-time days, so I might finish nights on a Monday morning, but other than that, Mondays and Tuesdays are me time. Just working less hours makes a huge difference. It gives you a lot more recovery time from your shifts. It means that you're off more than you're in on an average week. And I find that gives you a lot more time to reflect on your patients that you've been seeing and what you've learned. And I find that actually I'm progressing probably at the same pace that I was doing when I was full-time, simply because I'm not as tired and I'm able to put in a bit more effort where I need to. It just means that on my days off, when my family are at home, I've got energy to actually go out and do stuff rather than just wanting to sit in front of the telly all day.
Yeah, true. Agreed to that. Totally agreed to that. So, like we talked about the advantages, what do you think are the disadvantages basically of going full-time?
There's a few that I've thought of. So I think for most people, the main disadvantage is actually the pay cut, because you get used to what you're earning, you grow into your wage. And actually, if you do what I did and halfway through your training decide to suddenly take a huge 40% pay cut, for some people that can be quite difficult. There are ways around that. You're allowed to do additional bank shifts, 1 or 2 a month. So actually you can bring your pay up a little bit. You can't bring your pay back to what you were on before, but you can earn a bit more spending money. So that's the first one. The second one that I thought of, when we're rotating and we go into new jobs, it tends to take a good 3 or 4 weeks to actually settle into learning what the local processes and guidelines are, getting to know the nursing staff and other medical staff. It takes a lot longer when you're less than full time. I would say probably takes twice as long, and it's simply because you're not there as much. You've almost got to be a little bit more extrovert to get noticed and get people to know you so that you can get to know them. And it does take a lot of extra effort to look at the guidelines for whichever trust you're working for, just to make sure you're doing it how they want. What was the other thing that I thought of? The other thing that I thought of that I've discussed quite a lot with trainees that want to go less than full time, but also some trainees that have gone less than full time that are struggling, is that you're not in work as much. So you're not seeing the patients as much, and you're not getting that same pattern recognition that you're used to. And because your work constantly isn't on your mind like it is when you're full time, sometimes it just requires a little extra effort to get yourself back into the mindset of being a doctor. And I don't tend to struggle with that, but I know some people have struggled with that. And I think quite a few people are pushed into less than full time when they're struggling with their training, but actually it isn't always the right answer to get you through your years of training. I don't think anyway. It just means that you do need to put in a bit more extra effort when you're at work, but you should have the energy to do so.
Yeah, agreed. So, all right, Ben, so your take home pearls for people who are actually, still thinking in the thinking process of maybe opting for a less than full time. So what should be your guru mantra be like, okay, do this or do that?
Do it. I think particularly within emergency medicine, where you won't realize it yet, Aman, but in a few years' time, when you go on to that senior registrar rota, you're bombarded throughout that shift. You're constantly being thrown ECGs, VBGs. You've got a queue of junior doctors wanting advice. You've got a queue of nurses wanting advice. Plus, you're trying to manage your own patients, and it is exhausting. And as you get older and you want a family, or you've got other commitments either within medicine or outside of medicine, you've got to offload something. And I think if you can afford to go less than full time, and you've got years left within you, I'm only 32. I don't want to be a consultant for 30 years. Why not go less than full time and enjoy your training and regain that passion that you might have lost through exhaustion? I think people that are thinking about it should really strongly think about doing it and just committing to it. Go for it, get used to the lower wage, but actually enjoy your work again.
I'll totally agree to that, Ben. Like the word you said, losing the compassion in the run, basically. I can feel it. I'm still not in the training, Ben, but trust me, every day I'm questioning myself. Can I make a switch? Should I try something else? Should I do this, do that? Yeah, that is coming in between, I would definitely say. All right. So thank you so much, Ben, for your pearls and giving a brief introduction about what is less than full time. Apparently, for all of you who you've got any questions, you can leave those in the comment box. You can mail us. I'll give you the mail ID in the end. And for any other questions, yes, always open. So thank you so much, Ben. Thank you so much for sharing your valuable info and insights about less than full time. Hope people would like it. And that's it. Keep liking, keep sharing, keep subscribing. Thank you so much. Cheers. Bye.
My pleasure, Aman. Thank you.
Thanks. Bye.